It's June 13th, 2020. The number of COVID virus cases in certainly my country, in Canada and in Ontario, is going down. The mortality rate is going down. And so now we're starting to break away from our quarantine. We're starting to move out into the outside world more and more. So now it's time to start wearing a mask in public. It really is time to start wearing a mask in public. I'm Dr. David Murphy. I'm a physician. I'm a psychotherapist. I'm also a certified anesthesiologist. I've worked in operating rooms. I've worked in the emergency room. I know what it's like to be a frontline worker. And yet, although our emergency room physicians, our anesthesiologists, our nurses are called frontline workers, in fact, with all due respect to them, they're actually our last line of defense, not our first line of defense. They're our last line of defense where we become really sick, when we end up in hospital, we end up in ICU, when we end up in a ventilator. You and I are actually the front line of defense. We are the ones that make a difference in whether or not the virus is able to move from one person to the other. And that's what we need to stop doing. By wearing a mask, we stop the virus from moving one person to another, or at the very least, we hinder its ability to move from one person to the other. And that's what we need to do. We need to reduce the number of viruses coming our way. It's a little bit like a battle. If there's only 1,000 defenders and there's 10,000 attackers, the defenders will be overwhelmed. Our immune system is very like that. Our immune system can only cope with so many attackers, so many viruses, so many bacteria. And so what we can do by wearing a mask is reduce the risk that a large number of viruses will be coming into our lungs and into our bloodstream and start attacking our body. It will reduce our risk. And not only does it reduce our risk of being infected, also wearing a mask will reduce our risk of infecting someone else if we should have the virus without being aware of it. So wearing a mask is really starting to be important now, more important now than ever. The World Health Organization is recommending the wearing of a mask. National Public Health Officer, Dr. Theresa Tam here in Canada, is recommending that we wear a mask in public. There's a lot of evidence that countries and regions in the world that have been wearing masks generally have lower infection rates, or when they start wearing a mask, the infection rate goes down. It really is there now. The evidence is there. It's time to start wearing a mask. And so why do we wear a mask? Well, the other reason is, I think what we're finding out about this virus, we used to think it was just droplet infection, and now it's aerosol infection. What's the difference? Well, droplet infection is when I sneeze. Some droplets of water come out of my nose and my mouth. It's carrying the virus, it's carrying bacteria. And because the droplets are rather large, they tend to drop down to the ground pretty quickly. So my chances of infecting someone else within about 3 feet are fairly minimal. Aerosol infection is quite different. Aerosols carry much further. If a woman, for instance, sprays some perfume from an aerosol so that she's going to walk through it, you might be across the room and you'll still smell it. That means that aerosol has been able to travel across the room to where you are, so now you can smell it. The particles of the aerosol containing the perfume have gone into my nose. And so with the COVID-19, if someone coughs or sneezes or apparently sings, then we create an aerosol which is then projected across the room and travels a long way. And so the mask is important to cut out the aerosol. Now, I'm lucky. I have one of these masks. We happen to have done some drywall in our house just before all this started. We had an N95 mask hanging around, so I use this when I'm out and about. My wife actually made some masks for us too. Used 2 pieces of cloth sewn together with a piece of paper from a vacuum cleaner bag sewn in between. A vacuum cleaner bag is a filter. It will filter out, not everything, but it will filter out some viruses. Again, what we're doing is reducing the number of bacteria that affect us. And what we're doing here is attempting to prevent the second wave of infection when we all start going out and about. So it's really important to still keep that social distancing. It is important to stay away from other people as much as possible. We will make the difference in whether or not this virus continues to live and to be passed from one to the other. So it's time to start wearing a mask. I'm going to wear mine now. It's quite easy. So stay healthy, stay well. This is Dr. David Murphy saying goodbye for now.